Hello and welcome to Omnia Health Insights. My name is Deepa Narwani and I'm the senior editor at Omnia Health Insights, your one stop resource for all that's happening in the global healthcare industry. Currently, COVID 19 is continuing to wreak havoc in India. According to the World Health Organization report, hospitals in India are fighting for beds and oxygen in response to the deadly second surge in infections, and the country is accounting for nearly half the coronavirus cases reported worldwide and a quarter of the deaths. To make sense of the situation, today we have with us Dr. Mehul Mehta, the Chief Medical Officer at Albright Stonebridge Group, who leads the firm's health practice. He draws on decades of global healthcare, medical education, and life science research systems experience to advise on the development and implementation of healthcare education and research systems around the world. Welcome to Omnia Health Insights, Dr. Mehta. Firstly, I would like to ask you, how did things go so wrong for India? Is the new double mutant variant the reason behind the surge in cases?
So thank you for having me, Deepa. And I wanted to also thank Informa for hosting this and for propagating information that I hope will help people as they manage through this wave, especially in India. Yes, it is an enigma that a lot of people uh, are looking at. And let me tell you what I think has happened. To understand this, you have to understand that the in any pandemic, the spread of the disease is really contingent on a balance between the infectivity of the virus and the resilience, or if you will, the receptivity of a population to get infected, right? So what happened if you looked at the early part of the year where the entire world was wondering at India's success, and India itself felt that they had got over COVID, uh, the virus had reached the balance between its infectivity and the people's resilience against it. And that came from multiple angles. Number one, the nature of the virus has changed. The virus has mutated, like you mentioned, and what we saw before and what we see now is a very different strain. So that dynamic shifted. The second dynamic that shifted was that people felt that they were over, the pandemic was over, they were over the crisis, and they let down basic public health measures. When you let down public health measures, you actually expose yourself. Remember, the body has not seen this virus before, right? So these basic public health measures are really critical to protect yourselves. And so what went off was masking, which is really fundamental, and even proper masking, because you saw people wearing masks but not really covering their nose and mouth. You saw crowds forming, and you saw the distancing issue being completely devolved because people started to aggregate in large functions. So all these created an environment that resulted in the opportunity for now a mutated virus, or even if it wasn't, the opportunity to spread, because the virus mutates only if it replicates. It can only replicate if it infects. So the second big thing you saw happening was the fact that the virus had an opportunity to replicate, therefore mutate, and the mutations actually make it spread much faster. They do two things. They actually make the contagiousness increase, and they also do what's called immune escape. It has elements of it that help it escape the immune system. The third thing that happened is vaccinations had not taken root. In fact, even now, vaccination numbers in India are very low. Therefore, you had a susceptible population. Now,
Mm.
India did a seroprevalence study and found that in certain parts of at least the metropolitan areas, in the lower economic classes, there was 50 to 55% more of antibodies.
Yeah.
But that leaves half the population vulnerable. And if you see where the spread is occurring, it's occurring in the middle class, upper middle class, the affluent class. So you have a combination of multiple factors, a virus that is much more infective. You have a population that is more susceptible, and basic public health measures were broken down, and they resulted in super spreader events. So the combination is what you see happening. And so when I was asked early part of the year in newspaper interviews as to, why is India such a success story, my response was that we are not out of the woods yet.
Yeah.
And that this dynamic, if it shifts, it's going to move in one direction or the other. You can move it in the other direction also if you have a resilient population. And the only way to get a resilient population is to vaccinate. And
Exactly.
so that's the reason why vaccinations are so critical.
So, what has been the role of contact tracing? So, if efficient contact tracing was in place, could this situation have been avoided?
So, yeah, so I guess your question is, let me broaden it a bit. What are the measures that could have been taken to avoid this situation? I mean, that's fundamentally what you're asking. So all the elements that should have happened, if they had happened, we would have not seen this situation in this extent. It would have been a much more muted situation.
Yeah.
So yes, first is actually prevention. So if all the preventive measures had continued, right, that you still mask, do not allow crowds to that extent, open things up, but don't allow these opportunities for super spreading, it would have contained. Once you have a spread, not only contact tracing is important, because that's part of the public health measure. It's
Yeah.
contact tracing, it's identification, and then it's isolation,
Yeah.
right? So that is all important. Now, just to underscore why contact tracing is so important, if we had a very robust national contact tracing or regional contact tracing mechanism, is this virus has a heterogeneous spread. People don't understand it, and I'll try and explain. It's called the K value. What happens is few people infect everybody else. So
Yeah.
it's not a homogeneous spread that everybody infects everybody else. Few people infect everybody else. So you have to find those super spreaders, these individuals who are actually highly infective and infecting the rest. This actually gets accentuated much more when you have a mutation because they actually can spread much faster. So, yes, contact tracing was important, but the really biggest thing to understand what is causing the spread, are there new mutants, is genomics.
Okay.
And genomics, India pulled together a sort of genomics network only in Jan.
Okay.
And the way we did it is we actually, India looked at all its national research laboratories that had genomics facilities and capabilities, and then they tried to connect them through the help of external entities like the large genomics manufacturer Illumina to
Mhm.
create, and through other expertise, to create a national genomics system. Now, it was done in Jan. Many parts of the country need genomics. For example, the National Genomics Network doesn't cover the city of Mumbai. The
Okay.
closest genomics center for Mumbai to provide inputs to or get genomic sequencing done is in
Mm.
Pune. So Pune, the National Virology Laboratory does it.
Okay.
Now, the important thing of genomics is when you see positive patients, you do the genomics and then you have to correlate that to the clinical picture. There are many mutations that are non-relevant,
Okay.
and there are mutations that are relevant. If you don't correlate a mutation with the clinical relevance, you miss the picture. Just looking at a mutation has no value. So
Yeah.
if you see the clinical relevance, then you know, my God, this mutation is causing a different clinical picture. It's spreading more. Younger people are affected. And in fact, it is the picking up of this mutation in Maharashtra that we actually found the B1.617 mutation, right?
Okay.
That has features of the South African mutation and the Californian mutation. So we need much stronger genomics. I'm glad they set up the National Genomics Network, but even that needs to be significantly augmented. And big cities where this is really spreading fast need their own genomics infrastructure.
Okay. Like you mentioned earlier, the vaccine rollout has been quite slow in India. Despite being the highest vaccine manufacturing capacity in the world, why is this the case? Like, and also what can be done to rectify this?
Yeah, it's a very interesting question, and actually the answer is very complicated. And I'll tell you why the answer is complicated. India's vaccine manufacturing, I mean, if you took, there are two manufacturers we have, right? Bharat Biotech for the killed virus vaccine, and Serum Institute, who's licensed in the manufacturing of AstraZeneca, and then subsequently Novavax. Novavax is not yet out, but that's a vaccine that'll also have a great impact. Now, what has happened is that many factors have constrained it, but if you look at the most predominant one is global supply chains are highly stretched.
Mm.
Novavax and Bharat Biotech cannot, Serum Institute and Bharat Biotech cannot manufacture vaccines in the absence of vaccine supplies. Vaccine supplies are very overstretched because of multiple factors. First of all, these are very specialized manufacturers of equipment, materials, consumables that you need to manufacture vaccines, right? They are stretched because there are multiple sites that want their products. The demand has just skyrocketed. They are rapidly expanding capacity, but a lot of what they manufacture is also used for other diseases.
Okay.
So for cancer treatment, for your chemotherapy drugs, for your biologics, many of their products are used. So now you have a global environment that has to provide the basic raw materials or the elements to manufacture vaccines. Suddenly the demand has gone through the roof because there is a crisis all over, right? You have large entities like the Serum Institute that need it to ramp up,
Yeah.
and you have demand from other sides. So they are in the unenviable position of having to make really hard choices. Do they take away from one to give to the other while they're trying to expand? Obviously, we want to see vaccinations expand dramatically all over the world. Nobody will deny that. But along with that, we have to figure out how do we make sure that that expansion is possible by the going upstream in the supply chain and making sure the supply chain also has the capacity to flex up.
Okay.
So this is a global problem, and it's a global problem that has to be addressed now. And in
Yeah.
fact, that's one of the things we are trying to do in our own role as ASG. Um, let's assume that you can provide all the supplies that you need overnight. Will that make a difference to the current uh, surge that's happening in India?
Okay.
I think that if you look at what will happen, let's assume you provide all the supplies, vaccines ramp up. Remember, from the time you do that to the time vaccination gets into people, there's going to be many, many weeks of lag. Manufacturing has to ramp up, vaccines have to be distributed. You have to rapidly vaccinate a massive population. Let's assume there's unlimited supply of vaccines. We are in the middle of this big, big crisis. So months of literally weeks and weeks will go by. After you give the vaccine, if you're talking of at least the AstraZeneca, after the first dose, it takes 3 weeks to reach 70% efficacy. Forget the second dose. Then you have to go to the second dose, which optimally is 8 to 12 weeks away. And then you reach 90%, the 82 to 90% efficacy that their numbers are around 83, 84%. So if you think of that whole window, this crisis needs another intervention.
Yeah.
Yes, vaccines would prevent the fourth wave, but this crisis needs vaccines now.
Mm.
And getting vaccines now means that India has to get vaccines from the global vaccine supply chain, which is again under enormous pressure.
Yeah. Hopefully, like there is the Russian vaccine that is now coming, so
Yeah,
hopefully it will help.
I think all vaccines will help now.
Yeah.
We need to get vaccines and then push manufacturing as fast as possible, but manage the global supply chain issue in terms of helping manufacturing. But the issue is getting vaccines now. And I think that's why I think the country has opened up to say you can purchase directly, companies can purchase directly. But that's the immediate answer if you want to get protection in. Apart from that, we are trying to really help the health system, get oxygen in, reduce the pressure on beds, try and get as many medications as possible in that work. Lots, there's a lot given, but data only really supports a few.
Exactly. Like you said, that there is so much burden on the supply chain. There is also a lot of burden on the frontline workers right now in
Yeah,
India. What
yeah,
and May is Mental Health Awareness Month.
yeah, yeah.
What would you say has been the impact of COVID-19 on mental health?
Yeah, so this is a very important topic. It's a topic that I am very involved in because I also am on the board of trustees of the American Nurses Foundation, which is part of the whole group is the American Nurses Association. Frontline workers all over the world and in India have actually reached a point of total burnout. You know, the mental health, the physical health, the risk they put themselves to, the risk they put their families onto has been untenable. And it has been relentless. So what we see happening globally is burnout is a massive issue, and burnout among all health professionals. So I want to call out nursing in particular. Nursing, at least from the data that was done in the US through the American Nurses Association, what we saw is high rates of burnout, high rates of actually loss of trust in the systems. It's just really interesting. They don't trust the system, they don't trust the information they're getting. And there's financial burnout also, because you go relentlessly day in and out, day in and out, day in and out, and they reach a point where they can't take it anymore. So there's also the uptick of suicidal ideation. The problem is actually very important to tackle, because that is your bulwark, that is your sort of, without the healthcare providers, you cannot fight this. You cannot fight the severe disease. And interventions have to take place. Nurses in particular, who face the patients 24/7, they need to be, so all forms of interventions, whether it is counseling, whether it is finding different ways to reduce the pressure, finding financial support, providing them the right information. And this is true for physicians also. Physicians are searching for information. What is valid, what is not valid. So there has to be a strategy that's equally important to make sure your core workforce, the ones who are battling this for the whole world, frontline, and in India especially, are supported.
Exactly. So, where does Albright Stonebridge Group come here, and how has it helped support the fight against COVID-19 in India?
So we came together as a volunteer group when this was happening. Myself, a whole bunch of my physician colleagues, we came together. We had support of the leadership of the firm, and we said we have to do something, right? So when you look at it, there is so much you can do,
Yeah.
but we said we have a unique platform because of how the firm is structured and how broadly networked the firm is, to do things that maybe others can't do. So we decided to focus our efforts, and all this comes on, after the office hours, so it goes late into the night, on three areas. And we believe these three areas we believe are important to strengthen India's response. The first area is really trying to push the dialogue. And I just got off the phone this morning, right before I started with you, with a very large group, talking to the Rockefeller Foundation, talking to other groups, that we know, how do we increase vaccine supplies for manufacturing to take up? What can we do? I reached out to our manufacturers and tried to find out what are their pinch points. How can we make sure that we can work through? Can we actually have a global dialogue on what are the priorities in which manufacturers can work on? To putting them in a situation to make choices is very hard, because every manufacturer will think they're pulled in 500 directions. We have to come together as a community. Can we relieve this burden? Can we improve vaccination? And I measure it in a very simple way. If by our intervention and our facilitation and our raising awareness, we can shift getting more vaccines out by a few days, you can count it in lives saved. It's very simple. So that's the first thing. So this is sort of what I call an amplification intervention. Can you intervene to amplify? Obviously, it means convening, it means corralling lots of people, it means bringing other groups to help you convene it, like the Gates Foundation, like Rockefeller, like the World Economic Forum, lots of groups that you can bring in that the, the firm has the power to do. The second is to enhance India's genomics surveillance capacity, right? Because we are doing less than 1% of genomic assays on positive samples, and we need to ramp that number up by a large factor. So how do you do it? So we are actually working currently as we speak to enhance the genomic capacity of a city, uh, because that's what is needed. And we are fortunate we have some of the world's largest genomics entity who's very willing to help. So we are working on that, and I think it's early, so I sort of hesitant to share specifics until it evolves, but that is actually getting a lot of positive traction, and probably in the subsequent interviews I can update you. And the third is education, which is our relationship with Informa. And Informa really very graciously stepped up to say, yes, let's put education content.
Yeah.
So we have turned to some of the leading academic centers of the United States. They've been very gracious, like Johns Hopkins Medical School, like Mass General Hospital, like Brown University. And what we are doing is trying to put content on that will help physicians and help patients. So while we are not in a position to develop content as a firm, because that's not what we do. We want to bring the best thinking and then let physicians in India in one place have a choice. They understand, they can read it, they can synthesize it. When they are firefighting on the front line, they don't have time.
Yeah.
The same thing is with patients. I mean, I have last 1 year, I've been talking and teaching on this, and at one stage it was every weekend, and the questions just keep on coming. And I understand patients are really scared. If you go to the hospital, my pulse oximeter is showing this. When do I go? How do I buy a concentrator? Do I need a concentrator? What medicines should I be taking? When should I be calling my physician? So giving some basic guidelines based on evidence from these major institutions and from experts that we will bring in. That's what we are doing. And you are kind enough to host it, Informa is. So we are working together to do this. And I think that you'll see roll out in the next few weeks. So you have three areas: vaccines, genomics, education. And we believe that if we can, let's say in education, help physicians keep patients at home, and help patients also stay safely at home and get over their COVID, and reduce the pressure even by a fraction of a percentage in hospital beds, that'll have a cascading effect on everything, right? So that is the strategy for each of these three things.
Makes perfect sense. So, Dr. Mehta, just to conclude, what are the next steps you think that India should take to survive this?
Well, immediately there's firefighting going on, right? So you have to contain it and use whatever measures we can leverage right now. So there is never one answer. One is to deal with the current fire and parallel to build up the infrastructure and the ability to prevent the fourth wave, because we cannot afford a fourth wave. So in these measures, you know, all the things need to be ramped up very fast: testing, tracing, also containment. Containment is very critical. So people have talked of lockdown. Lockdown is what I call a huge blunt instrument that has a lot of consequential damage, but at some stages is the only thing that you have in the absence of having a therapeutic drug that works. We don't have one. So we have to get much more active India is doing it. I mean, absolutely, we are firefighting on multiple levels, but we are in the middle of this fire, and all the help the country can get is going to move the needle. But we have to move to very rapid containment of this current, crisis, and then prevent or prepare with greater strength for the next wave, so that we don't see the next wave in this manner. We actually you have a muted wave or a contained wave. That's what I think is going to happen. And I think all the strategies you're seeing are playing out. Increased vaccine procurement, that's happening. Oxygen supply, trying to decant hospital beds, creating alternate sets of treatment. Remember, the wave is spreading, right? So Mumbai maybe is seeing a drop in numbers now and maybe in a better place, but you see the north, it's spreading now. It's going to, and so you'll see this as it evolves. Um, each of the cities has seen what's happening and has to prepare. So they have a chance to prepare. So they have a lead of a week, 10 days before it hits. So that's again another strategy, because India is such a large country, and Mumbai saw it first. Now Delhi is seeing it. As it spreads, other cities, I think, would be well advised to prepare.
Yeah, great. Thank you so much for your time today, Dr. Mehta.
Thank you. Thanks so much. And yeah, I'm really happy. I'm honored to be here.
Great.
Take care.
Thank
Bye.
you. Bye.